Hey guys, welcome back to my channel. For those that are new, my name is Josephine. I'm a registered nurse and midwife, and on this channel I talk about nursing, fashion and lifestyle. I'll also be presenting to you some other topics that are not coming from the area of lifestyle or the area of nursing or the area of fashion. So don't be surprised if you see another video that is just popping up that is not related to what I'm just telling you here. I will just sometimes bring up some other videos that are not related to what I'm saying as well. So this is just sort of information. If you are new on this channel, please don't forget to like, share and subscribe, and you are most welcome. I really appreciate that you are part of me and you want to join my family. I really appreciate you for that. And if you are returning, thank you so much for coming back, and I appreciate that you're always in the house. I really love you so much. You don't want to know that. I love you so much. Just continue liking, sharing and subscribe. Do not forget to leave a comment on the comment section down below. With that said, let's get to today's video. In today's video, we are going to talk about the fear that patients, my patients, everyone out there is my patient, right? Because I'm a nurse. The fear that patients are always carrying when it comes to them visiting health services regarding STIs. When I'm talking about STIs, and this is what I'm going to preach about today, I'm talking of sexual transmitted infection. That is just an abbreviation. STI stands for sexual transmitted infection, and this is what I'm going to talk about today. Well, I just want to say I'm not going to favor anyone here. I'm not going to side women. I'm also not siding men. I'm not siding the youth. I'm not siding nobody. I'm just going to rely on the fact. Statistically, women are more likely to visit health services than men. And this is also something that I have observed or noticed since I started my nursing training. Because when I was a student, we would be deployed into clinics to do community health science, and this is what we would be exposed to. So what happens is men really rarely come to the clinic, or if they come, they don't express their problems so openly, especially when it has to be STI related problem. And women tend to find it also a little bit tough, but they take it up to themselves to express themselves, and then they tell you about their problems, and they also show up to the health services. Mostly they come, but when it comes to men, it's quite difficult. Well, when you have an STI, this is something that you don't have to play around with. You don't have to waste time, and the signs and symptoms for STIs are more noticeable because these are not usual thing. When it comes to sexual transmitted infection, really, it's not something that you would say, it's something that you have been having for some time, so it's not bothering. It bothers you because sometimes you'll be having a little bit of a sore on your genital area, and it's very painful. It's very painful. It will be burning because of the urine that goes somewhere. Sometimes it gets dry, and then it will be paining as well. So this is not something usual to you, so you are not going to be comfortable. You change your mood, sometimes you become so aggressive, sometimes, but it's just because of that. So when you see that you have any threatening issue with you around your genital, just visit the hospital, because you yourself might not pick what type of STI you have, or you will not know how to treat it. Just visit the hospital. The nurses will be helping you. Doctors will also help you. There are also some rumors that goes around about especially amongst the young people. Young people will be like, you only get STIs when you sleep with multiple partners. That is not necessary. I don't even have to talk about it. It's not important either. What is important is, what problem are you going to pick with yourself that you need to take to the hospital. As for now, it's not important. And it's also not important for you to say, I know when I have STIs, and I know when I I know when it's serious. It's not necessary. Just go to the hospital, get help, and then you'll be fine. That is the most important thing. So I'm going to bring you some steps that involves with visiting the clinic or health services, because there are certain steps that you have to go through and that are done to you when you visit the health services regarding the sexual transmitted infections. Do not worry. You don't have to worry. You don't have to be embarrassed. You don't have to stress. You don't have to, if you pick that there is something wrong with you and it's genital related problem, please just try to visit the clinic. Try to visit, if you have a medical aid, can go to your private doctor. If you don't have a medical aid, you can go to any public health services. They are going to give you attention, extra attention that you didn't expect. So we are going to talk about the steps. There are just 3 steps, I think 3 or 4. I think there are just 3 steps that you go through, and then you are done, and then you are treated. Well, reality is sometimes it's common that STIs will not give you some signs, or it will not give you any presenting symptoms. There are times that people will just pick it up when they go for medical checkup. Like when it's picked, that's when you pick that, oh, I have an STI, but I never got sick. I never even experienced any problem. That's when you start, even especially men will start accusing their girlfriend. I think it's this girl. I think I don't want her. You don't have to blame anyone because you don't even know where it's coming from. What matters is that it will be treated. You just have to refer your partner as well for treatment, and then you'll be fine. And then yeah, we are going to live a happy life. So we are going to move to the steps. Like I said, number 1 step is visit the clinic. Visit the clinic. If it's not the clinic, visit your doctors. The health professionals, the nurses, clinic staffs, doctors are there waiting for you. They are not sitting there for nothing. They are sitting there waiting for you, so that they take care of you, so that they assist you, so that they help you. These are trained professionals, and they know what they are supposed to do when they see any type of cases, especially cases like this. They are trained on how to handle them. You don't have to be embarrassed of anything. You don't have to feel ashamed of anything. Feel free and tell them what your problems are. One thing I noticed about men is they will come to you telling you about their leg pain, their feet pain, about how they are unable to breathe properly, and how their back is paining, aching so much. If a man comes to you telling you like that, of course you have to make a lot of questions for you to pick what could really be a problem. Because sometimes if you are not too curious also to learn, you just treat the headache or the pain, and then they go home tomorrow, they come back again, just because they can't tell you what is their problem. They really find it difficult to express themselves. What I want to emphasize here is, please, if you are a man that is watching this video, please start to open up today, especially when it comes to the STI. The sexual transmitted infections are not good for your health. Please just open up when you go to the health facilities, so that you get the good and the right treatment at the right time. And also the nurses and doctors that you are going to find, they are not going to judge you. They are not going to question you unnecessarily. They are not going to pose any personal questions when it comes to these things. They have certain questions that they are allowed, or that they do ask, because I told you they are trained professional. They know how to attend to all the cases. Step number 2, give more information. Just provide all the necessary information to any person or any clinical staff that is attending to you. If it's a doctor, please provide all the information. If it's a nurse and any other person, but mostly nurses are the ones that tend to attend to the patients first before the doctors. Just give more information so that the person knows how to treat you, or they know whether they need to refer you. The nurses are also going to ask you more questions regarding the problem that you are having, and they mostly have to ask about your sexual history, and they can also ask about your general health. Most of the questions that are involved are like, when last did you have sex, whether you have had unprotected sex, or whether you have any presenting symptoms of sexual transmitted infections. Like I said, they are not going to ask you any personal questions. They are not going to ask who your girlfriend is. They are not going to ask where did you have sex. No, they are just asking further questions that relates to your condition, so that they learn and know how to help you. That is all. You don't have to worry. Just be free and provide the information that regards to what problem you are having. And here we are talking about sexual transmitted infection that involves mostly with your genitals, and this is what you need to provide information on. Step number 3 is the STI testing. So the STI, when it comes to the STI testing, the doctor or the nurse that is attending to you is going to further explain to you that they need to carry some investigations, or they need to do some testing, so that they know, just to pick some specimen and send to the laboratory, or they do a rapid test that moment, or they just test the urine sample, for example, that moment. But they have to explain to you what they are going to do, or what they are planning to do, for you to get assisted or for you to get helped. So there are certain blood tests that, there are certain tests that you might expect, like urine sample testing. and then blood testing. Sometimes they do HIV and syphilis testing. That can be, they will get to collect your blood and then they send to the laboratory, and then such things. Those are the most testing that you are expecting. And then also sometimes, and most importantly, they like to examine the genital area for any source, more especially if you present that you seem to have sore, or you can't even walk properly, or you have some discharges. They would want to see the discharges, because especially on women, they tend to do the urethra swabbing, so that they, just for all the testing to be carried out, and then for you to be treated properly. You don't have to be scared of anything. Their preference, I know there are clients that are preferred to be seen, especially men will be like, they want to be seen by men, and then and women wants to be seen by women, but this is not able. And sometimes if you want it to happen that way, it can happen, but then it will take you time. You might stay there for some times waiting for the right person that you want to come for them to attend to you. Sometimes, especially at public clinic, there are only maybe 2 ladies, and then you want to be seen by a man. A man is at another hospital, so you either be referred to that hospital, or the man will be called to come to you the second day, which is also just a long process. Just don't have to worry about anything. When it's a nurse, when it's a doctor, they are health professionals. Like I said, they are well trained. Don't worry, they will just attend to you and they help you, and they are not going to disclose your genitals or whatever problem they found there to nobody. They are not going to do that. The last step is step number 4, receiving your results. So the receiving of your result, the doctor and the nurse is going to discuss to you. It depends on what testing was done. Like I said, sometimes they do vulvar swabbing, or they do urethral swabbing, whatever swabbing that is done. They will send to the laboratory, or whether it's blood test, they send to the lab as well for further investigations, or for specimen checks and all that. Then they will discuss with you the day of you coming to, of when you should come back for your follow-up. So the day you are coming back for follow-up, that is when you are going to get your result. But there are also, for example, urine, we have a urine dipstick test that is done just that moment, and they give you the result. And also there are times, like I said, sometimes they would want to do the HIV testing and syphilis. Like for the HIV, there are rapid test kits that can also be done. But with all the testing that are going to be done the moment, like if you have to get your result, they have to do pre-counseling and post-counseling with every result that you're going to get. So we are then expecting some result that might come out positive. Clarity. When we are talking of positive and we are in the hospital field, we are talking of something that is bad. The positive part of in the hospital area is not something right, or it's not something to really be proud of, like as in other general English, because when we are talking of positive, I one time picked a scenario of, I heard it from someone telling the other person that her friend is happy because her result came out positive. She went to the hospital, her result came out positive. I felt so pity. I felt really so pity, because I've realized how, I didn't show it to this person, but I've realized how the person got wrong information, or they didn't ask further, or maybe when the explanation was done, she was already happy that her results are positive, and she took it other way around. So when we are in the hospital, negative is something that is good. When it's positive, it's always bad. It means there's a certain bacteria in the testing that was done, or there's a certain virus in the testing that was done. There's also a certain infection in the testing that was done. Then they will tell you that the results came out positive, and this is how it is. Like I said, they do counseling as well. They get to explain to you. They will explain how your expectation should be 2 results that can be positive and negative, what is positive, what is negative, before they disclose the results to you. Sometimes if it's positive, then they will sit with you, then they explain everything to you. They explain about the medications, or if they have to extend the medications and so on. They also give you a a partner referral card so that your partner also get treated. This is sexual transmitted infection. Of course, when you are talking of sexual transmitted infection, we are talking of a couple of infections. It's a lot of infections. I'm not talking about them today. We are going to bring them up in another video, and I'm going to explain to you what we expect when it's STI, the symptoms, the treatment, and what you need to do when you find out that you have STIs, where to go, and all that. This was it about today's video, and if you have any comment, please just comment down below and tell me how you're feeling about the video. I thank you so much, and stay well.